Testing, testing. This is Stefano Virgili from Vox Podcast, and today with me is Diane Ha. Hi, Diane.
Hi.
And Emilian Popa from Elara Healthcare.
Hi, Stefano.
Hi, how are you doing?
Good, how are you?
Very well, very well.
Okay. Sorry, I just want to jump in to do a quick intro on Emilian before we get him talking about what Elara Health does. So I want to spend about a minute or so talking about Emilian because he's a special, or he has a very wholesome experience, I would say, in the entrepreneurial scene from the standpoint of being a founder of another company before Elara, as well as the CEO of Groupon, and more on the nurturing side, or accelerator program, a few accelerator programs as well that he was involved in, as well as being an investor. So Emilian Popa, thank you for your time, for coming on the show. And if listeners want to check out the website, we're talking about Elara Health today, ILARA health.com. And briefly, the way I would describe Elara, or what they're doing, is working to lower the cost of diagnostics in Kenya, ultimately Africa, ultimately the world. Emilian, let me pass it to you to elaborate further about this and how you're doing it.
Exactly. So, look, thanks, Dan. I always start describing what we do at Elara by talking about a clinical officer or a doctor whom I met the very first time when I came to Nairobi and we started Elara. And his name is Dr. Boniface, and he runs a small clinical center in one of the low-income communities called Karangware, which is actually in the middle of Nairobi. And when I met him, I asked him immediately, what would you need to better do your job? And he immediately told me, I would love to have a small lab. And this was an aha moment for me. And that was really the beginning of Elara. And this was back in Jan, Feb last year. And since then, I visited personally over 500 clinics and community pharmacies. And I realized that the quality is shockingly poor. So that's how we really started to build Elara, where we also know that 70% of clinical decisions in general require some kind of diagnostics. But there are 500 million people in Africa who struggle to access or afford a simple blood test. So at Elara Health, we actually bring more affordable and accessible diagnostics in Africa, but also we try to improve the quality of care, which is actually very, very, very low. And interestingly enough, one of our advisors, Dr. Jha from Harvard Medical School, says there are 3 million people who die every year in low and mid-income countries because of lack of healthcare, but there are 5 million people who die because of lack of quality healthcare. So there are more people who die because of the quality problem than because of a lack of access. So that's exactly where at Elara we position ourselves by, bringing a more affordable, accessible diagnostics and improving this massive gap in quality of care. So just in a summary, we do 3 things at Elara. Actually, tap into this this exponential growth of diagnostics, where what we call today the smartphone medicine kicked in a couple of years ago, where all those big devices become smaller and smaller and can be plugged into a phone. So we tap into this growth of diagnostics or miniature point of care diagnostic devices. We partner with the companies which make the devices, which are located somewhere in the US, in China, in Singapore, in India. We bring those devices into Africa. We plug them into a technology platform which we built to be able to manage them remotely. And we place them last mile into small clinics and pharmacies located in the outskirts of the main city. So it's not in Nairobi itself, for example, but in this kind of a band of 10, 15 kilometers located outside the city, where actually there's another few million people living and having access to those small medical centers. So that's exactly where we place those devices on a lease-to-own model, so on a very affordable monthly payments scheme, to be able to allow those small clinics to access those diagnostics and the respective tests.
Thanks, Emilian. Now, so just to digress a little bit, we'll come back to the type of diagnostics that Elara Health is providing. But one of my first conversations with you about Elara Health, I was actually really curious about what brought you into health, because your background has been very businessy, Groupon accelerator programs and whatnot. Can you talk a little bit?
Sure. So I'm actually I've been passionate about healthcare for a long time, and I strongly believe in identification of diseases at stage 0, and this comes from issues that my family or friends have had, and if they were able to test themselves early enough, they would have been probably in a better position today. So I'm a big believer in this, and I apply this to myself and to people around me. In the same time, I know Africa really well. I've been on the continent for over 12 years, building ventures, investing, and I've been trying to for a while to find I would say a commercial or a commercial model around how I could build a healthcare company which would achieve what I want to do from a personal interest, but at the same time bring value to everyone, and that's how I've got here. My passion for diagnostics it's been a while. I go every year to see a doctor in Cape Town. I do about 30 blood tests to try to see if there is anything wrong. If there is something wrong, go and try to solve this. At the same time, I believe strongly in prevention. So detection, I think detection is not enough to prevent. So I'm a bit of a health hacker, and do a number of things to try to help to live healthier, and try to also get people around me to follow this.
That's great. You're unlocking this. You're at least attempting to unlock this for so many other people. Stefano, I'm going to pass it back to you to talk business.
Sure. I'm actually curious about the name. What does it mean?
Sure. So interestingly enough, before we called the company Lara, we called it Ilera. And Ilera in Yoruba, Yoruba is a language which is spoken in Nigeria, means health. And we're looking actually starting Nigeria at the time. And this was back in 2018. Ilara is not something that came up just a year ago when we launched the company. I've been looking at this for a number of years, and so we kind of baked this, or I baked this in the background for at least 2 years before I started the company. And so looking at Nigeria to start initially as an initial market, and we ended up doing Kenya.
Interesting. Thanks for sharing. So the healthcare, health tech in general, I sense it's quite hot, has been quite hot for a while. I guess investors are jumping onto you because of your background as an investor yourself, your past experience. Would you like to tell us something about how the fundraising is going, and if you are currently fundraising as well?
Sure. So we raised a seed round back in June last year. We're currently raising another seed round, another post-seed. We're actually in the middle of it now. Look, fundraising is never easy. I come from a venture capital background, so I'm actually fortunate enough to, have been on the other side of the barrier, and I'm also an investor. So I do personal investments in startups in Africa. But fundraising is never easy, even for people who understand, have done it, have raised money in the past. We are also fortunate to be in healthcare, and I think today healthcare is actually on the first line the news. We're in the field, we're boots on the ground, we're helping the healthcare providers to face the crisis. So it's somehow easier for us, I think, today, because we provide a service and a product which is needed in a healthcare crisis. So it's going well.
Can you disclose some numbers? Can you tell us what's your objectives in terms of further fundraising, if you are currently raising?
Sure. We're raising $500,000 of post-seed round, so we're in the middle of the race currently. So I mean, the traction has been good. So I'm confident that we will close our round in the next few months.
Cool. Congratulations. Can you describe how the business model works and
sure.
why you? I mean, why Elara?
Sure. So I think I mentioned earlier, at Elara Health, we do three things. We partner with diagnostics companies making those small portable diagnostic devices. And those are not the Philipses, the Siemenses, or the Gs of the world. Those are not a startup sitting somewhere in the US, China, India, Singapore, Taiwan, which make those small devices, but high tech. We bring those devices into Africa. We integrate with APIs into the clouds of those devices. Most of those devices are actually plugged into a phone, so they have a cloud. And we place them we lease them or rent them, if you want, to the clinics on a very affordable monthly payment. Now, how do we make money is obviously it's I would say, besides the fact that we're a healthcare company, we're an asset leasing company, because we place those devices, we lease them. So obviously we make money over time through this lending model. So this is what we do today. We're also, we get a lot of data from our diagnostic devices. So the data is not monetizable today, but we start to actually collect hundreds and thousands of patient data sets, which allow us to, first of all, identify what other devices, what other diagnostics are needed in those markets, in those clinics, but also to think in the future, how can we monetize this data, which start to allow us actually to understand exactly what are the reasons patients go to see one of those small medical centers. We know that, for example, 28% of the patients go to see those clinics because they have a respiratory infection, which is super, super interesting, mainly in a COVID setup where, respiratory, pneumonia is actually one of the results of COVID. So data is super important. We don't monetize it today, but we collect it. We use it for our, internal kind of device selection, and we start actually to build partnerships with pharma and healthcare companies.
Interesting. And are you planning to expand into other business model? It sounds like at the moment is a B2B
Sure.
structure. So basically you work with the clinics. And so there is a limited number of clinics, I guess, that you can work with. And then probably the next step will be either moving to another country or perhaps exploring other segments. It could be B2C, for instance, sure, having plugins or tools for mobiles.
Sure, that's a great question, actually. So the market is actually surprisingly very big. I always bring this number. In France, for example, there are 1,000 medical centers, clinics. In Kenya, there are 15,000 small clinics, all very, very small. And they can't do much. They can consult, they usually sell drugs, sell medicine, like this doctor that I mentioned to you when we started. So they want to make more revenue. So they all want diagnostic devices. So if you look at the market in Kenya, there are about 15,000 private and public medical centers, half of them private, actually. We look at 5 markets in Africa. Together, they have to about 200,000. But even in Kenya, to get to the 15,000, to get to 10% of the 15,000 is going to take us 2 years. Now, what we've started to do, we launched, because some of those clinics are too small to take an asset, because we know pertinently that their patient volume will not allow them to pay back, to use a diagnostic equipment and pay it back to us. But they still have, patients coming to see them for a blood test, for an imaging, for an ultrasound, etc. We tell them, how about you actually, send us those patients, and we're going to perform the diagnostics in our own lab. And like this will actually help them, but generate also revenue for us. And we cover this second part of the market, which is, as I said, too small for us to place an asset. So we started to build labs. We actually built the first lab in one of the low-income outskirts community of Nairobi called Embakasi. So we started actually the lab this week. And this lab can do about 50, 60 tests a day for now. It's a small lab. It's definitely not a big lab that we've seen the automated labs, but it's a lab equipped with also mobile, small devices. And the plan is to build 10 of them. So that's something that that's, I would say, the second business line that we're building now. Look, in the future, so with those labs, actually, we can clearly, I mean, we can build up to 50, 100 in Kenya. The market is big enough. And as you mentioned, there are opportunities to expand into the neighboring markets, countries which have a similar healthcare to Kenya, I would say Uganda and Tanzania. There's also, Nigeria, Ghana, there is Ethiopia. We plan to go to a second market after our Series A, so it's going to be next year.
Interesting. And can you share the price point for the devices, like in US dollars, how much you charge?
Sure. So the device is when we buy a device and we place it on an affordable, let's say on average $250 a month for a ultrasound. So ultrasound is a good example, right? So an ultrasound machine that you probably have seen, when you go and you need an ultrasound somewhere in Europe or the US or Asia, right? Costs $40,000-$50,000. That's a big machine. Today there are companies making the same the same quality machine, but which is a size of which is a portable machine, which costs a couple of $1,000, anywhere $4,000, $5,000, $6,000, and that's exactly where we tap into. Now we release this machine, so the machine is already 5-10 times cheaper than the big machine, but the quality is the same. The clinics in our areas cannot buy the $40,000 machine, but they can't buy the $5,000 machine either because they don't have enough cash. So what we do is actually lease this machine for around $250 a month over 24 months. A clinic would charge a pregnancy ultrasound, a pregnancy scan for about $15. So, with only 20 tests a month, they actually can cover the cost of the machine and can pay the machine back to us to $50, and they can make actually enough revenue and make a profit. And that's actually the end range of what we do. You probably, one knows that the main reasons a patient goes to see one of those clinics are actually it's diabetes, cardiac disease, pregnancy scans, as I said, and infectious and respiratory infections. Now, Kenya has about, the official numbers are lower, but we believe that it has somewhere between 10 and 15% of Kenyan adults are diabetics or pre-diabetics. And interestingly enough, 2/3 of them don't know. For the cardiovascular diseases, very similar. So 2 of our devices identify markers associated with diabetes and cardiovascular diseases. And those are actually very, very cheap devices. We place them for anywhere between $20 and $80 a month. But in the same model of a lease to own, where the clinic uses and pays over time $20 a month over 24 months. So it's very, very, all those devices are affordable, but the results are super impactful. And not only that, allow those clinics to identify disease and treat, but also make revenue to the clinics. And this is a very, very important point, because the way we look at those clinics are all small merchants. They need to make money, they need to survive, they need to pay their bills.
How many of them are you working with at the moment?
So we're in 60 today. We were in 50 at the end of last month. So we add on average 1 clinic per day today. So we've been growing extremely fast in the past couple of months.
Wow!
And we plan to get to 200 by June and to 500 by December.
Wow! Have you experienced any situation where the machinery has been stolen or damaged, or issues that can be intentionally or unintentionally?
Yeah. That's a great question. So we, because we integrate those devices with our tech platform and we control them remotely. So really we implement think of an IoT system where we can turn them on, we can block them if we want. There's no incentive for anyone to run away with the asset, with the device, because they can't use it otherwise. And we make it very clear when we place the device with our clinics. So we haven't got any single case where the asset would be, the device would be stolen. Also, there is little incentive for a clinic to run away, because we block it, and they need a device to make money. And if we block it, they can't use it.
Clear. And in terms of data, how do you handle data, GDPR and whatever is applicable to Kenya?
Sure. So data belongs first of all to the patients and to the clinics. That we look at the data so we don't take name without associating the data set to a certain individual. We are interested in why someone goes to see those clinics. So how many respiratory infections are, how many pregnancy, how many urinary tract infections, how many whatever else, how many diabetes. We work very closely with IBM. We're actually part of an IBM healthcare and fintech accelerator called HyperProtect, and IBM actually provides us all the infrastructure to store this data and use it in line with the GDPR and all the regulations. Also, we look at the Kenya regulations, which now are pretty similar to are in line with GDPR.
Thank you very much. Diane, over to you.
Thanks. So Milian, I'm just trying to piece it together story-wise. So from the end user perspective, and then from the clinic perspective. So as maybe a mother, an expecting mother living in Kawangware, and if I'm not making much money and I'm going to the clinic, usually, well, before Elara Health, I guess I won't be able to check on my baby and whatnot. But now with Elara Health, am I following this correctly? So I could potentially pay something like $15 instead of something like hundreds in bigger hospitals that are far away in my neighborhood clinic. And then at the same time, so creating access, meaning in terms of, location-wise, plus also affordability. And then for the clinic, they're essentially, before this, maybe they might not be able to do, this kind of, they might not, what do you call that? When you, what is that procedure when you're checking for the baby?
What, a pregnancy scan or?
Yes, pregnancy scan.
Yeah,
Sorry.
I'm
clearly not in this field, but yeah, so now they have that as a new revenue stream. They can probably earn, I don't know, something $10 per scan, and maybe pay a fee of I think you were saying around $20 to $20 or so per month in terms of leasing the products. Am I following correctly?
Yeah, totally. So look, indeed, one, in principle, a woman will need 2 scans during pregnancy, right? It's funny enough, we actually, one of our first major medical camps that we did in one of our clinics, located also in Kayole, actually, which is one of the East Nairobi low-income communities. We brought 300 women. We were expecting 70 and then ended up getting 300 for a scan. Wow. We were actually offering this scan at a very low cost just to test the market. And I was actually interviewing the women before they were getting the scan, asking them, have you ever had a scan? And then most of them did not. And it's super interesting because not having a scan, it's super necessary, right? To scan in, there are two moments during the pregnancy when one needs to have an ultrasound. But so you asked me the question of what happened before. Well, the two level of pricing so Nairobi in one of the big hospitals or clinics, private clinics, you need to pay $70, $80 for a scan. In the outskirts, the price goes down to $15, $20. Now the question is the access. How many of those clinics can really purchase a standard ultrasound machine and offer scans? Well, there are not many. So there is some kind of access. So if with or without Ilara, those women can get a scan, but they will need to find one of those clinics which has an ultrasound. They usually have old machines, black and white, no color Doppler, so the quality is really bad. And they will need to wait in line and then get a scan whenever the clinic is available. Also, the second thing is that clinics do not have usually sonographer available to perform the scan. So if the woman comes, they need to call someone to come and then use the machine. Now, in the Ilara model, when we equip all those clinics with a portable ultrasound, obviously the access becomes instant. The access to a sonographer also is taken away because what our device has a telemedicine functionality. So the clinic wants to use the device, the ultrasound, but doesn't have the skill to use it and doesn't have access to a sonographer. We actually provide over the phone, over the image, over internet access and scan capabilities, which is super interesting because it's very, very, that's something which is super new and completely solves the problem of accessing the services of a sonographer, of a radiographer. And from a price perspective, the clinic now can charge less. So if they had a machine which they probably purchased for, I don't know, $10,000 or more, they're bound to charge a higher price to be able to amortize the machine. When they buy a machine, or when they have a machine and they pay only $250 a month, they actually can charge less than $15. And then that's something that we, as we grow, we'll be able to control better the pricing than we do today.
Sorry, a quick question. Sorry, I jump in. Is that your business model as well? I mean, the devices that you are getting to Kenya, you buy them or you lease them? So
we buy them ourselves. We buy them. So we invest cash to buy the devices and through equity and debt, and we lease them on the other side to clinics. So it's like a lending model. Finally, we buy something for X and then we lease it for a certain amount a month.
I understand. That's great. I mean, the manufacturer must love you because you're selling one new device a day now, one new client a day.
Yeah, exactly. They love us. And also we actually, the other way you can look at what we do is that we open the access to those markets to manufacturers which otherwise would not have the access. Again, our manufacturers are not the big, the Gs, the Siemenses, the Philips, which may have distribution forces and distribution, distributors in those markets. I mean, think a bit of the Tesla model. Most of those companies making the diagnostic, the new world diagnostic devices are actually, they don't have a distribution model. They sell online. They focus on their own markets. So we really open the Africa market for those diagnostics manufacturers because we distribute them. Not only we distribute them, we place them, we lease them, we finance them, we connect them, we distribute them. We can keep the data back to the device manufacturers or whatever data they need to be able to improve their devices. And this is an amazing proposition for those diagnostic devices. And there are more and more. Maybe when we started Ilara, there may be 15, 20 companies making anything in those areas in terms of diagnostics. But this is exponentially growing. Today, there are like 3 times more. If you look at a pipeline of those small companies making super, super smart devices, there are thousands and thousands in the pipeline. So in the next years, there will be a massive growth. It's a bit of what happened in the smartphone industry 20 years ago and what's been happening. 20 years ago, there were maybe Ericsson making one device, and today there are like thousands and thousands of companies.
Interesting. Emilian, so I want to come back to, you were talking about ultrasound and also providing a sonographer sort of expertise. So what products do you have in the market now with the clinics that you have, and what do you see coming soon? Sure,
that's a great question. So today the way we look at it, we wanted to cover the basics. So we wanted to understand what's kind of the 60-80% of the need, why people go to see those doctors, and then place and then come with a diagnostic device, because we know that as I said, in 70% of the cases, one would need a diagnostic before the consultation or coupled with a consultation. So today we do cardiovascular disease and diabetes. So, and non-communicable diseases are massive in emerging markets and have been taking over the infectious diseases. I mean, COVID aside, but that's this trend of NCDs taking over the northern infectious disease has been growing. So cardiovascular and diabetes. We have 2 devices doing markers for the diabetes and CVDs. We have one small electrocardiogram machine, a portable one, which is the size of a pen, versus the big the big machine with a bunch of contacts that exist in the old world. We have the ultrasound, portable ultrasound built by a company called Butterfly in the US, which is one of the most innovative healthcare and diagnostics companies in the world today. We will also soon bring a machine which is built by one of Butterfly's sister companies, and this is an MRI machine which will cost probably somewhere around $100,000. Think of a typical MRI machine which is the size of a room and costs $1 million. This is a portable one which is the size of I would say a photocopy machine and will cost 10 times cheaper. And that's something that we'll bring probably in Q3, also again made by one of the Butterfly sister company. We have a hematology machine. Hematology is a massive demand in Kenya. We will bring a next generation hematology machine very soon. We look at ophthalmology. Massive demand, massive need in ophthalmology, and the market is completely open. It's interesting. One of our friends who runs a portable. So he goes to corporates and tests for example Uber drivers for eye diseases, and he was telling us one in 30% of Uber drivers don't see well, and they will need glasses. Wow. Have you ever seen in Nairobi an Uber driver wearing glasses? I haven't.
I'm scared.
So massive opportunity in ophthalmology. We're actually brought now a full suite of ophthalmology devices, from early detection to glass prescription to eye like fundus scan. So end of the eye scan, everything plugged into a phone. So that's something that is going to come very soon, and we plan to launch this next month. Wow. And from here we're moving into more complex things, which are like such as cancer. So we're working with 2 companies now and looking how to bring their devices. One company based in India, which makes this. They call it a breast cancer, breast tumor heat camera. So it's something that you see in the air, like similar to what you see in the airports, right? When they scan for COVID, you can do the same to scan the breast and identify tumors, because the tumors are hot, wow. The temperature camera can identify not only the tumor but also whether or not there is a cancer to it. It's a cancer or not cancer tumor.
Sorry, Emilian, all these things you're talking about, I've never heard MRI scanner that is the size of a photocopy machine, and this tool that you're talking about from India, where you don't even need basically a mammogram anymore. It's just kind of like a scan.
It's very new. This is very new. I mean, it's the same. Like think of probably your your iPhone today will become smaller or will become foldable next year, right? I mean, have we really here? Yeah. I mean, if someone reads a lot around foldable smartphones, you're probably going to see articles about Samsung and Apple bringing foldable phones, but it's not that they are in the market today. They will come next year or in a year from now. That's something that the diagnostic industry today is, the high-tech diagnostic industry is in a very early stage. So there's a lot of innovation, and there are a lot of companies working on those projects. The challenge is, unlike the other technology sectors, diagnostics is a very regulated industry. So those companies need to go through FDA in the US, through CE stamp in Europe, and need to get approved in every market. So the time frame from innovation to a commercial product is actually very long. So actually, we follow those companies from the day when they have something available, but even before any kind of regulatory approval, and we go through the process with them. And as soon as they have a product, a commercial product, we bring it into the market. So all those companies I'm talking about, I mean, the ones that we have today in Kenya are actually FDA approved or C approved, but the others are in those various stages of evolution from a prototype, but before probably the regulatory approval. And as soon as they get a regulatory approval, we bring them in.
That's amazing. Kenya is going to be the first to get these sexy tools. That's
in Africa. The first, in all honesty, the first in Africa. It's not nothing much available.
Yeah, brilliant. Okay, in the interest of time, I want to jump to my last question. So, okay, we talked a little bit about COVID. Now, tell us, how it's affected your business.
Sure. So COVID, I think we're fortunate in Kenya. Kenya has I think close over 200 cases today, and over, I think there are deaths, but Kenya has been spared for now. That doesn't say that this is not gonna, the pandemic is not gonna kick in and explode really. So the way we look at COVID in Kenya, we believe that there is a way to avoid clogging the healthcare system, which is already in not the best shape in Africa, right? So how do you prevent people clogging the hospitals? Well, you need to identify symptoms as early as possible in this chain of primary healthcare, staying home, primary healthcare, testing lab, hospital. So we also, because we are in this kind of first line of defense, so those small clinics are everywhere, we believe that we're able to prepare those clinics to actually prevent, so I would say not stop, but keep people at this level and not send them farther in the healthcare system unless there is a need. So we've developed actually what we call a readiness package for those clinics, which starts with a very basic assessment tool, which is questions and answers tool. It's available on our website. We put it on our tablets that we provide at clinics. We also have it now used by some of our partners. So Tala, the lending company, just put the tool on their own mobile system, site. So this tool will tell someone, don't worry, doesn't seem you have anything, stay home, or go and then get tested in a hospital, depending on the symptoms that you have. So this is the very, very first, I would say, line of defense. The second line.
Sorry to interrupt, Emilian. Can you explain a bit about how Tala, how it works with Tala?
Oh, so we have this tool which we developed, which is a suite of questions, and to ask you, first of all, your age or where you live, and then do you have any fever, cough, etc. It's like a survey. It's like you call it an assessment. It's an assessment tool. So fever, you identify the symptoms, and the questions follow and guide you through it's not a full diagnostics, right? But it's yes, you may have it. Have you been in contact with someone? Have you traveled, etc.? Yes, you may have it, or no, but stay home. So this tool now is on our website, on our tablets, or with other partners on other partners' websites or mobile sites. And Tala is an example.
Stefano, just so you know, Tala is a big micro lending firm in Kenya.
I'm quite familiar. Actually, so they are Indian. Originally, they are
exactly. Exactly. So we just offer We offer. I mean, we developed it. We offer for free to any company which wants to use it. That's the very first line of defense. The second line of defense is now patients. People will come to those clinics because, as I mentioned, 1 in 3 Kenyans go to see a primary healthcare clinic because of a respiratory infection anyways. Well, COVID, between knowing that it's COVID or is a whatever, laryngitis or a pharyngitis, you don't know, right? So people will start going to the clinics. Now, what happens when they get to the clinic? So we have now a massive training program with our clinics, which starts with procedures. What do you do as a clinic If someone comes with a fever or cough, how do you check them before they enter the clinic space? How do you put them in a separate room? What are the questions that you need to ask? What do you do with them if you see they can't test them? They don't have COVID tests, COVID rapid tests, because they're not allowed in Kenya yet. But how do you make the decision whether or not that the patient is a potential COVID or not? So that's something that we're doing now. We're rolling out. We're going to have this coming week a webinar with our clinics and other clinics, and then we already started to deploy these procedures and train our clinics. So there's a second line. The third line is all our devices detect at a precondition. So that we know that people with diabetes and cardiovascular disease are way more prone for complications. The echograph, the ultrasound has a lung. The pregnancy is one thing, but has a lung scan mode, and that's perfect for pneumonia, and it can clearly identify whether or not a pneumonia is a COVID pneumonia or is a normal pneumonia. So all our devices are related directly or indirectly with COVID. We're also bringing now, we're trying to go through the Kenyan approval with an app, an Australian company which developed this app. We call it the Shazam of coughing. So you cough into the phone, and the artificial intelligence model behind tells you this is a pneumonia, this is another infection, this is something else related to any respiratory tract, upper or lower tract infections.
I've never heard of that.
Yeah.
Okay,
so
awesome.
that's something so that's kind of the third line of defense. And lastly, if there will be an outbreak, and if there will be a need for example, ventilators, we actually bought a few 3D printers in our office now, and we're ready actually to 3D print ventilators, to 3D print PPE, so protection equipment, face shields, which are needed actually. Our clinics don't have any PPE, don't know what to do, don't know how to protect themselves. So that's kind of the last thing. And we could also bring rapid tests. They're not yet approved in Kenya, so we haven't got into this, but we identified the proper FDA approved manufacturers for those COVID tests, so we could bring them in if needed, and if there will be a directive from the government.
Wow, you know what, Emilian, I feel so much safer being in Kenya now during this time based on what you're doing. Stefano, bounce back to you.
Yeah, just one last question about competitors. Seems like your business model is very easy to replicate, but at the same time, seems like you are miles ahead of the competition, and it's going to be tricky for anyone to, at least in the same geography, to come in and rebuild all the network of vendors that you have established.
Right. So look, I mean, if you look at what we do, I mean, we're a mix of a number of things, right? There is the relationships with those device manufacturers. I mean, it took us years to build them. Can they be replicated? Yes, it's just a question of time. Then there is a technology, the IoT platform that we build, and integration with APIs into devices. Can it be replicated? Yes, but again, it's a question of resources and time. And then there is the last mile distribution, which is very difficult to replicate, because you need to understand how to do distribution in Africa, in those areas. You need a great sales team, which needs to be trained, and it takes a long time. And I think that's very difficult to replicate. So if you look at all those three things together, we haven't seen anyone really doing what we do today. I mean, there are distributors of diagnostic equipment, which they sell big machines to hospitals. They do the distribution part, but there is no technology behind, and then they work with the same kind of traditional diagnostics companies. So there are companies doing one of those three things, but we haven't seen anyone doing the three things together.
Yeah, that's what I like about the business model, that you have combined elements that per se are relatively easy to replicate, but they require time. But combining them together is like taking the ingredients and coming up with your own
recipe. Exactly.
Thank you for sharing.
Thank you so much.
Emilian, this is amazing to hear your what you're bringing to Kenya, to Africa, leapfrogging the continent in terms of access to medical technology, and then also particularly so extremely relevant in general, but also even more relevant at this time. Thank you so much for what you're doing, and thanks for your time, Emilian.
Thank you so much, Dan. Thank you, Stefan.
Thank you. Great meeting you.
Thank
Thanks for
you.
sharing.
Bye.
Bye-bye.
Take care.
Bye.